Welcome to the Charles County Update. I'm Commissioner President Peter Murphy, and today I'm joined by Brandon Jones, who's the CEO of Hospice Charles County. Welcome. We're glad to have you here today. We want to hear a lot about the good things that Hospice is doing in Charles County.
Thank you for having me.
So maybe you can tell us a little bit about some of the services you provide. I know Hospice has been in the county for a number of years, and I'd like to know a little bit about some of your programs and also maybe some of the upcoming events that you have.
Yeah, we've been around for a while, and some of our challenges making sure that folks know that we are here. Specifically, we have a wonderful house. If you've not been there, you've got to get out there and take a look at it. We have scheduled the tour link on our website so that folks can arrange time to come out and just take a look at the facility. So the house has been there for 5 years. As of this past December, has 10 patient units in there. The organization, though, has been around for about 35 years. This is actually our 35th year. So we have a host of events going on throughout this year to kind of commemorate those years of service to the community.
And I know that, for 30 of those years, Hospice was still very, very active in the county and did a lot of in-home care. And so it was really a landmark when Charles County was able to build one here right in the county. And it's a beautiful facility. I have been there and had the opportunity to do that. And as you mentioned, I would certainly encourage our residents to take the tour and to see really the good work that goes on there. So.
Yeah, the house is, like I said, 5 years. We're still working on making sure, increasing the awareness of our community and making sure that we have a house there. And the purpose is really to provide inpatient care. So not every patient is able to receive the type of care or the level of care that they need in their home. So that's why we have the house there to provide 24/7 nursing care and medication management, a little more fine-tuned care for patients that they can't always receive at their home.
Right. And I think one of the things that's so important about that is that it is certainly beneficial to the patient because they're in a much more home-like setting, but it's also a great relief, I'm sure, to the families.
It is.
Because, having to, they're not necessarily caregivers, they're family members, they're loved ones. And so to have their loved one being taken care of by professionals, I think is probably somewhat of a relief to them. And to have them in the facility that you have to offer, is really a bonus. So I think that's probably one of the greatest benefits is that they have, we're able to help both the patient and the family.
Right, that's very important. And that's what I stress when I speak to colleagues and community partners. And certainly having the patient in the home is a huge benefit to the family. Not only are they able to just take a load off, literally take a load off and allow us to really do the job for them, they're able to focus more of their time with their loved one, and certainly in those last moments, days or months or however long it may be, they're really able to focus their energies on their loved one and having the family around. We have minimum restrictions in terms of what they can bring in the home. We've had pets come into the home. Families can bring, other pieces of furniture to their rooms if they need it, just to make it as homey as possible.
And to really personalize that whole process, right?
Right.
Yeah.
Right. And that brings me to a point of the other benefits of the house. So it's imperative that we get folks in there if they have a high level of need, and we call that general inpatient care. But we also provide other levels of care, one being respite. So if you have a caregiver at home and they may be going on vacation or they may need to be hospitalized themselves and there's no one else to care for their loved ones. So we have respite care, which provides them, again, a break. And we can have them in our home for, I think, 5 days, allowing them time to do what they need to do, and we can take care of their loved one while they are away.
Yeah, I think that's really important. I mean, from the standpoint of both the patient and the family, it's not easy taking care of someone who needs that level of care. And so if the caregiver starts to run out of emotional energy and so forth, they're not being able to provide as much care, maybe at the level that loved one requires.
That's true.
And it's also not good for their health,
That's
either
true.
physically, I think, or emotionally. So giving them that opportunity for a break, I think, is incredibly important. And that they know that they're in really good hands during the time, and they can really go away and kind of recharge. So that when that loved one comes back home, they're ready to be able to get themselves back up to the kind of level of care that they'd like to be able to give them. So I think that's a really important service.
Definitely. One other benefit that we have for the in-home patients as well as outpatient, it's usually critical. It's a core service that we have. It's bereavement care. So we have our support services team, which includes social workers. We have a chaplain, also have a part-time chaplain. There's bereavement coordinators who are all social workers by profession. That's their training. But they're able to provide, and a team of volunteers. So they're able to provide, once the loved one has passed away, then 13 months after that person has passed away, then the family members, those surviving family members still receive some type of bereavement support or grief support at least 13 months afterwards. So hugely beneficial to the families. I say every time, hospice is really about the families more so than the patient.
It's all one unit, and you're right, to be able to serve that entire family unit,
Right.
I think was one of the things that makes hospice really particularly important and beneficial. And I think you make a really good point, because many of us that have experienced the passing of a loved one know that at the time of that passing, there's a lot of activity going on and a lot asked of us, and so we don't oftentimes get a chance to really focus on what that loss really means to us and to our family. And so the service to be able to provide that kind of support longer term has got to be really very helpful to the families. And I applaud you for providing that.
Thank you so much. For us to continue providing that care, we've got to, and we have, and I'm sure you're aware of those events. We have tons of events throughout the year. We have to raise funds because although probably about 70% of our patients are Medicare eligible, they receive Medicare benefits, those Medicare services and reimbursements don't always cover all of the cost. Certainly when they are admitted to our house, there's additional costs that just the reimbursement just doesn't cover. So we have to provide, host fundraising events throughout the year to kind of cover those extra costs that are incurred.
So this would be a good opportunity while we're here to talk today a little bit about some of the events that you all have coming up. And you can maybe share that with our residents so that they have different ways to be able to support hospice.
Certainly. Yeah, so as I mentioned at the top of the segment, this is our 35th year of service. So we're celebrating our 35th anniversary this year. So we're taking advantage of that and using that as momentum to kind of really advance some events throughout the year to raise money, again, to provide the additional patient care that we want to and need to in the patient home. So 35th year, so we've embarked on a Drive 35 campaign, and we're going to engage, and we've already started engaging our Charles County Chamber member organizations, and we have a Drive 35 ambassador opportunity for those businesses to sign up, and we will send them canisters, which are little donation canisters that they can kind of display at their place of business. So their patrons can donate. So we'll hopefully collectively be able to gather all those funds from those different partnering agencies and organizations and kind of put all that in our big fundraising pot for the year. And we're going to culminate all of those activities into the fall of this year. September 15th, we're going to be hosting our 35th anniversary gala. So all of those events are going to culminate into this really nice event where we're going to kind of advertise and promote those partners who helped us throughout the year.
Sure, good. And I think, having that kind of a schedule and a plan really does give the community an opportunity to participate in a lot of different ways.
It does.
And this is a community involvement, and it's a community asset really for us. And so we'd certainly encourage businesses and anyone else who wants to participate by donating, and they can do that easily. So we're glad to hear that those partnerships are going on.
Yeah.
So good.
And other ways for partners, folks in the community to donate is always going to our website. It's www.hospiceofcharlescounty.org. There's a big donate button. It's on all of our email signatures.
Probably one of the largest
everywhere.
things. That's right.
Just click that and it takes you where you can certainly donate any amount that you'd love to do. So there's an option there. Also, volunteers. We always need volunteers to support us. We have a team of over 75 volunteers now. They help us in administrative support, patient care, CMS guidelines require that we have volunteers as part of the care team. So there's intimately involved in the patient care processes any of the clinicians and support staff.
Right. And I think that is so important when you start to talk about the success of hospice, and that's your volunteers. You know, you couldn't do the good work you do without that support of people that are so compassionate and are really available to people at a time that's really, you know, such an important transition in not only their lives, but in the lives of their families. And so we really want to congratulate. And I think it's another example. I try to say this whenever I can. We have plenty of them in the county. But this is another example of what makes Charles County the amazing county that it is that we have people that are willing to give their time, and in your case, their heart, to other people's lives, whether it's at the end of life or, as you had mentioned, you even have stuff that continues after. So this is a very rich county in many ways, and I would certainly encourage those that do have the time and do have the compassion and interest to be in touch with you and to offer their talents and their gifts as volunteers to the organization and to the house. Yeah.
Yeah, I will echo those comments. I say every time when we bring on new staff members, hospice is a calling. It's not a job you come in to make money.
It's not. No,
it's not. We're not here to get rich or make money off of the services, because it's a commitment. You have to really want to do it. So when I bring on new staff members during the interview process, one of the questions I always ask everyone is, have you had a personal experience with hospice? Have you had a loved one? Has there been, a close friend or someone has gone through the hospice process for you to be kind of involved or engaged with it? And if they say yes, it's another kind of check off for me to be comfortable having them, be a part of the team, because I know you're driven and this is what you want to do.
And that you choose to do this work, right? Right. Yeah. I think one of the things before we wrap up is if you would talk just a little bit about the location of the hospice house. For a couple of reasons. Number one, it's certainly for people that may want to take the tour and get a sense of what you do, which may be another way to have people who may be interested in volunteering. And as you talk about that and give the address, I want to make a comment about the location, because I thought it was a very visionary location, and that is you're next to two of our public schools. And so being that part of the community, and you're not off in an area that is hard to find, but it's really there. And so as people come to our schools and so forth, they can see the hospice house and recognize that it's there and the importance it is in our community. But if you'd like to let folks know what the address is so they can come by and visit and get the tour.
Sure. So our hospice house is located on 2505 Davis Road, which is right around the corner, literally around the corner from the big North Point High School. So I think most people are familiar with North Point High School, Diggs Elementary. So we're right around the corner from there. It's been great for us because we've been really able to partner with the students on quite a bit of activity. So we just recently had some carolers come over during Christmas to sing from North Point High School's culinary department, which has been absolutely awesome. They
do a wonderful
provided
job.
A lot of really good food for us at our chamber mixer. Mm-hmm. So it's a great opportunity for us to interact with students, get them involved and engage with hospice as well.
And it's an amazing opportunity for our young people to be able to see how important it is to serve and to be able to get comfortable with that aspect of life, because I'm sure many of them lose family members, it could be grandparents or whatever, and so it gives them that access and exposure, which I think is a very healthy interaction for them. Yeah, it's great. Good. We want to thank you very much. Thanks so much for coming in today. Thank you and your staff and all the volunteers for the good work you do for those families in our county who need your services. We appreciate that very much. And I take this opportunity to encourage everybody to support you in your upcoming fundraisers, because I know in order to provide the services that you do, it costs money. And you're not asking for a lot. You're asking for people to honestly patronize those businesses that are participating and to be able to give what they can and to know that it's going, first of all, it's staying here in Charles County, which is incredibly important, and second of all, that it's going to help families at a very difficult time in their lives. So again, thanks very much for all the good work you do and for being here today with us. And thank you all for watching Charles County Update.